Hi everyone, this is DermDad here, bringing you the 7 best treatments for acne. And this is basically coming from a dermatologist standpoint. And what I'm going to try to do is just go through the different categories. These are all common treatments, describe each category and some of the advantages and how they work. And this should give you a leg up next time you're talking to your dermatologist or even your primary care physician, trying to figure out what the best treatments for your acne are. So with that, we're going to just dive right into the 7 categories. Keep in mind that this approach is going to vary from one dermatologist to another, and these are really my own personal opinions. So the first category that I want to talk about today, number 1, is cleansers. And there are many different cleansers that people have used for acne. Common cleansers out there have salicylic acid. There are various kinds of soaps, charcoal soap, herbal soaps. Really, what I would say is I generally recommend that folks try to use mild soaps. Salicylic acid can help with keeping the pores from getting clogged, but we don't want to overly dry out the skin, so a lot of times I just recommend Dove soap or something mild like that to try to avoid irritation so that patients can go ahead and use some of the medicated treatments. So that moves us into the second category, retinoids. And retinoids basically help with clogged pores, keeping them from becoming acne cysts, comedones, and they're also very effective in removing blemishes and scarring, but this does take several months, so it's something that you'd have to kind of keep up with over 6 months to a year to see that effect. Common retinoids, there's different 0.1%, that is over the counter, the 0.3%. There's also tretinoin, there's retin-a, there's Tazorac, and there's some others out there as well that we'll kind of skip on for now. But there are numerous retinoids that are available, and they all kind of have the same overall benefits. So moving on, next category, benzoyl peroxide. Benzoyl peroxide has been shown to have antibacterial property. It's a great product. It is available over the counter. There are prescription versions. It can come as a wash. It can come as a wipe. Even as a cream. Main caveat to benzoyl peroxide is that it can and certainly will bleach clothing and towels. Just have to be real careful with it. It is pretty irritating and drying to the skin, so it has its place. We try not to use it a lot on the face, but it is good for body acne in particular. The skin on the trunk is not as sensitive as the areas in the face. So as we'll see, benzoyl peroxide has its place. Topical antibiotics, category number 4. So here we have various topical creams and lotions. The old one used to be erythromycin. Clindamycin is probably slightly better. These are well tolerated. They do come in wipes that can be used, say, after sports and that kind of thing. But the main issue with these is that they do cause significant bacterial resistance when used by themselves. These can be great for on-the-go type of use, for example, while at school or during travels. The most common use of the topical antibiotics is generally going to be in a combination product. So we're going to kind of add another category here, 3 and 4 put together to form what we call the combination products. This is usually going to be benzoyl peroxide plus a topical antibiotic, either clindamycin or erythromycin. And these are usually found in products such as benzomycin, benzocaine, and Duac. A lot of times these are the products that you get that are put in the fridge just because they're a little bit less stable. But these are great products. There's less bleaching, there's less resistance. They're quite effective, but there is some dryness associated with using these, so just be aware of that. So this moves us on to the last 3 categories. These are going to be various pills. The most common one that you'll see are antibiotic pills. There are 3 categories within antibiotics, but the 2 commonly used nowadays are doxycycline and minocycline. Tetracycline used to be pretty common, but it's just not used that much anymore. But the antibiotics are generally used for their anti-inflammatory property. It's not really treating the infection itself, but it's just more the inflammation, and they're very effective, but they're somewhat limited. Can't use them in really young folks, and also can't use them for too long. So number 6, here we have various kinds of birth control and a drug called spironolactone, and both of these work primarily for folks that have hormonal acne. This is usually seen in women, often monthly type of acne that tends to flare And for these particular situations, both of these work quite well. They have various effects on the hormone levels within the body and can reduce the acne, especially on the monthly flares. So there's certainly a place for this. A lot of the folks, especially on spironolactone, tend to like it quite a bit. Each of these can have some side effects that we'd like to keep an eye on, and that's something to discuss further with the dermatologist if happens to be the case for you. So finally, this brings us to Accutane, also known as isotretinoin, currently available under various brand names. But basically, this is an oral version of the retinoids and is very, very effective. It basically dries up the oil glands. It's considered a permanent improvement or cure for the acne, which is different compared to the other 6 categories. Main thing with this, there are known issues and side effects. Most people don't have any real trouble with it, but it's controlled through a program called iPledge, and it's something that one has to be aware of all the various potential side effects prior to getting on it. So I know Accutane is a hot topic, so definitely let me know in the comments if you'd like a detailed video just on Accutane in the future. So that's basically it. That's 7 categories for acne treatments, and brought to you from DermDad. Hope this helps. Thanks for watching.